And I'm going to be doing a chest and upper and lower extremities assessment today on my patient. To start, I'm going to have my cameraman kind of go around the room to see that there are no cheat sheets. And then before I would begin, I would check my patient's chart. I would enter the room and provide for privacy. I'd wash my hands, and then I'd introduce himself, tell him my name's Morgan, I'm going to do an assessment on you today. And then I would identify him with two identifiers on his wristband. Can you tell me your name and date of birth?
John Simmons, 9/20/86.
Great. So I'm going to first start off with asking you some questions and get a little bit of a history on you, and then we're going to do a physical exam on you today. Okay, I'm going to start off with asking if you have any heart murmurs or any known heart disease.
No.
Do you currently smoke or drink?
No.
Do you have any chest pain or any cough?
No.
Are you around any hazardous chemicals at your home or in your workplace?
No.
Are you currently in any pain right now?
No.
And then do you have any numbness or tingling in your hands or feet?
I don't.
And do you have any lymphedema?
No.
Okay. So now I'm going to begin the physical part of my exam. First, I'm just going to visually look at him and notice that his skin is of normal skin color for his ethnicity. It's nice and even. I'm going to look and see that his chest hair is even throughout, and then on his arm hairs, they're even throughout, and his arms are equal bilaterally. And then I'm going to check the back of my hand with his temperature, and he is warm and dry to the touch. And then I'm just going to check his skin turgor, and he is nice and hydrated. Now that I've done that, I'm going to continue with his neck, and I'm going to start with palpating his carotid arteries on each side. And then I would rate them about a +2, and they are equal bilaterally. Now that I did that, I'm going to go ahead and listen with the bell and see if I hear any brutes. So what I'm going to do is I'm going to place this in 3 spots on your carotid artery on each side. I'm going to have you breathe in, then breathe out and hold it. And I'm just going to listen. I'm going to do it 3 times going down on each side. So go ahead and breathe in for me, then out. Okay, breathe in, then out. And then go ahead and breathe in and out. And then take a deep breath in, then out. And then breathe in and out for me. And then go ahead and breathe in and out. Okay, no brutes were noted. Now I'm going to check for some JVD. So what I need you to do is lay with your head on this side and then your feet at the end of the bed for me. Here, no pillow, I'll have you lay flat. And then I'm just going to visually inspect and look at his neck on each side. And then I'm going to note that there's no JVD. So you can go ahead and sit up. If I did notice any JVD, I'd have my patient sit up at a 45-degree angle, and I would check again and see if I saw it. Now that that's done, I'm going to go ahead and visually inspect his chest. By looking at it, I can tell that once again the chest hair is evenly distributed. He has a relaxed face. He's breathing normal. He's not using any accessory muscles to breathe. Now that I visually looked at it, I'm going to go ahead and palpate. And I'm not feeling any lesions or masses, and I'm not feeling any crepitus among his chest anywhere. And now that I've done that, I'm going to go ahead and percuss the chest and see if I hear any abnormal sounds. And then while I'm doing this, I'm going to try and stay away from, I'm going to get in between the ribs and try not to do it on any bone. And then I'm going to go ahead and do this side. I didn't notice any abnormal sounds doing that. And now I'm going to go ahead and listen to his lungs and see how they sound. And then I'm just going to, every time I do it, just take a deep breath in and then out. And then deep breath in and out. Okay, deep breath. And then go ahead. Just move your arm. And then right up here. Okay. His lungs were equal on both sides. They were clear throughout. I didn't hear any adventitious sounds or any wheezing or crackling. Now that I've done that, I'm going to map out his heart spots, and then I'm going to go ahead and take a listen to those. So the first thing I'm going to do is I'm going to find the sternal notch, and then I'm going to go down to the angle of Louis, and then I'm going to go over to the right side, second intercostal space, which is my aortic, and then I'm going to move over right to the left sternal border, second intercostal space. This is my pulmonary. And then I'm going to go one down to the third intercostal space, still left sternal border. This is my Erb's point. And then I'm going to go down two more to the tricuspid. It's the fifth intercostal space, left sternal border. And then I'm going to move over right into the midclavicular line, fifth sternal border. This is my mitral. And at that spot, I would... that's where you find the apical pulse. If I was going to test for PMI, I would visually watch it for a minute and note if I seen any heaves or lifts. I'm now going to listen to his heart sounds that I just mapped out. Okay, S1 and S2 were heard. I didn't hear any extra sounds or any murmurs. That concludes the front side of the chest, and now I'm going to move to the posterior, to the back, so I'm going to have you turn around for me. And are you comfortable like that?
I'm good as I'm gonna be.
Okay, first I'm going to visually inspect his posterior chest. And notice that his skin tone is even throughout. I see a couple of maculars. He has one tattoo. Now that I've visually inspected it, I'm going to feel that it's warm and dry to the touch. And I'm going to go ahead and palpate. I don't feel any crepitus or any lesions or masses on there. Now that I felt that, I'm going to go ahead and map out his lung field so I can start to percuss. First, I'm going to start with C7, and then I'm going to have you kind of move your arm like a chicken wing. If you can kind of like move it back so I can do the bottom of your scapula. And then that is your T7, and then I'm going to go down 3 to about T10, and I know that this is my lung field for my patient. So now that I've done that, I'm going to go ahead and percuss the areas of the back. And again, I'm staying away from any bone and going in between the spaces. I'm going to go ahead and do it on the other side. Same thing. Okay, I didn't hear any abnormal sounds or anything like that. Now I'm going to go ahead and check for his symmetrical expansion. And again, I'm going to go down to T10, and I'm going to just do a little squeeze, and I'm going to have him take a deep breath in and then out. And both of my hands did move equal bilaterally for his expansion. So now I'm going to do some tactile phremesis. So what I'm going to do is I'm going to put my hands on you like this, and every time I do that, I want you to say 99 for me. Every time you feel my hands, I want you to say 99. So we'll go ahead and start.
99, 99, 99, 99, 99, 99, 99, 99.
Perfect. Okay, and the sounds did diminish as I got lower, which is what we were looking for. And now that I've done that, I'm gonna listen to his lung field on the back of his chest. Go ahead and take a deep breath in and then out every time you feel my stethoscope. His lungs were clear and equal bilaterally. I didn't notice any adventitious sounds, no cracking or wheezing. And now I'm going to have you kind of turn this way for me, swing your legs back over and kind of just stay sideways real quick. And I'm just going to measure his AP diameter of his chest. There is no barreling, and he is of normal ratio, a 1-to-2 ratio. So you can go ahead and swing back forward for me. And now I'm going to go ahead and do the upper extremities. I'm going to look at his arms, and once again I'm going to state that the skin tone is even, nice pink undertones. I don't see any edema on his bony providences. His arms are equal bilaterally, and then I'm going to go ahead and check his radial pulse on each side. And I'd rate them both about a +2, and they're equal. And then I'm going to go ahead and check his brachial pulse on each side. And I would rate those about a +1, and they are equal bilaterally. And now I'm just going to go ahead and check a couple fingers for his cap refill. And his cap refill is less than 3 seconds. So now I'm just going to do the lower extremities. If you just want to stand up for me real quick. If I was going to check his femoral pulse, it would be right in here, but I'm going to go ahead and check his popliteal pulse behind his knee on each. And I would rate those about a +1. They are equal bilaterally. And now I'm going to go ahead and check both of his posterior tibial pulses. And I'd rate those both a +1, equal bilateral. And then I'm going to check his dorsalis pedis pulse. And I would rate those about a +1, equal bilaterally on each side. If you just want to go ahead and sit down for me. And then I'm going to do a sensation test on you. I'm going to put this on your foot, and you're going to tell me if it's hard or soft and just kind of where you felt it on your feet. Is that hard or soft? How about that?
Soft.
And then that.
Hard.
And then that.
Soft.
And then that.
Hard.
Okay, and then we're just going to do a straight leg raise for each leg if you just want to lift them both, and then do one at a time for me.
Do what?
Okay, you can put them down. We'll do both together, and then just raise one at each time. Okay, go ahead. And then lift that one. Okay, go ahead. And then what I'm going to do, if you want to lift your feet up to me, and I'm going to pull on them, and I want you to pull back on my pull. Okay, now I'm going to push on them. I want you to push forward. Great. And then I'm just going to come back up to the hands real quick and just do the same on the hands because I didn't do that earlier. So first we'll do the grip test though, if you just want to squeeze my fingers as hard as you can. And then I'm going to do the push-pull test on your hands. So I'm going to have you lift your hands like this, and then I want you to push back against me by resistance, and then I'm going to pull and I want you to resist. Perfect, thank you. Okay, and do you need anything before I go? This concludes the end of our assessment.
I do not.
Okay, great. And that is all.